Hey guys, it's me, Becca Stokes. I'm a senior writer at Your Tango, and I'm sitting here in the spa waiting room at Smooth Synergy, where I will be getting an O shot. I just finished filling out my consent form, and now I'm reading through the list of potential side effects. There's bleeding, there's that the shot will have no effect at all, and there's the fact that I could have constant awareness of my G-spot at all times. I mean, that sounds like a benefit. I could have a sensation of always being sexually aroused, constant vaginal wetness, mental preoccupation of the G-spot, sexual function alteration, bruising, blood and urine. Now it's getting less sexy. An alteration of my vaginal sensations, parenthetical, usually with more intense pleasure. And then apparently I could have sex life alterations. Oh snap, anesthesia. I'm down. Okay, so I've read through all of this and I'm now going to sign. Good, how are you? Hi Nicole, I'm Becca. Nice to meet you. I love your necklace.
Thank you. So, hi.
You don't mind,
That's okay.
We're live and running.
That's great. Are you excited? Are you nervous?
So all of the above. I'm really excited about this.
I have it done, so
did you love it?
Love.
Oh, great.
Yes.
It varies on doctor to doctor. I'm receiving the service today complimentary, full disclosure, to review, but you can get it from anywhere from $500 to $1,000. It lasts up to a year, but there are people who get it once every 3 months who swear by it. It's also really great for women who are going through menopause or perimenopause, who are experiencing dryness or changes in their desire levels. I'm not menopausal. I'm just a sex writer, so.
Someone says you've got to be out of your mind.
Yeah, that's true. I mean, I like to think that I do these things so that you don't have to. It's less being out of my mind and more that I'm just very deeply concerned.
Hello.
Hi.
Welcome. So I'm George the Achaeus. Nice to meet you. You want to chit chat?
I would love to, yeah. We actually
Let's
have some
do
of
it.
our live streamers asking
Oh yes.
what exactly the procedure is.
It's actually not as unusual as you think. It's a topic obviously that some people have shied away from. But at the end of the day, it's called Platelet Rich Plasma. In this case, it's the O shot. It's Dr. Runnels who patented the term, but Platelet Rich Plasma, or PRP, is actually not uncommon and has been used for many years in other specialties.
Right, correct.
So orthopedists use it in joints. A lot of professional athletes have used it. We give it to professional runners. It is basically taking the part of the blood that stimulates your own body to make again, not to make again, as it's always making, but to make more of the young cells that are part of the healing process, so part of the stem cell family. There's other things that are out there like stem cells, and that may even be better. Stem cells are probably a little bit more aggressive, and it's a potentially dangerous thing because stem cells are blood products. So you have to know where you're getting it from, and it has to not be contaminated, and etc. But this is your own blood to tell your own body and the organ that it's put in to wake up, make more young cells, new cells, and in the hopes that it will rejuvenate or turn the clock back for whatever it needs to do. So the
Sensation, increased lubrication. It's a great treatment for women who are going through menopause or for anyone who has no dysfunction but is looking to increase the quality of their sex life. I forgot that because it's live. Very cool.
This is going to spin now for the next 17 minutes or 16 minutes and 35 seconds. So you'll see it. And at some point, this will go into here and the machine will separate into here where we're going to use.
Oh, fascinating. That's so cool. Take care now.
Wow.
What the experience is like, in case this is something you want to try. I'm a person who is also pretty anxious, and I have to say that the environment at Smooth Synergy is like A+. Super attentive, super sweet. They don't care that we have a camera in their face, which I love. So if you're a person who's nervous to talk to a doctor about your sexual dysfunction and you live in New York City, contact Smooth Synergy and Dr. George, because I, as the world's most anxious person, feel comfortable with him, so you most likely will as well. It's important to work with a doctor you feel comfortable with.
Help perimenopausal women.
The question is, how does this help perimenopausal women? Much in the same way that it helps women who are in straight up menopause, some of the symptoms of perimenopausal women suffer are dryness, pain during intercourse, lack of desire. All three of those can be treated with the O shot. It sort of depends on the person. The doctor's saying no one walks away pissed. You either walk away going, oh my God, this is life-changing, or okay, this is fine. And the worst case scenario is not experiencing any change at all. So it sounds pretty low risk.
It's your own blood that helps.
Yeah, the fact that it's, our cameraman just pointed this out to me if you didn't hear him, the fact that they're injecting your own blood makes it even safer because you don't have to worry about allergies or your body rejecting something because it's already part of you. I'm getting...
So normally when we draw your blood, it's all red.
Uh-huh.
These tubes have a little wax on the bottom, so when it goes in, it's all red. But once you spin it, you separate the plasma from the red blood cells.
Okay, very
And in the plasma are the white blood cells and platelets. The platelets, however, are denser than the white blood cell section. So when you see somebody just using the yellow, they could very well be doing it like from this just random blood tube, in which case it's platelet poor plasma,
Right.
or in a machine that is separating the densest platelets, in which case it's platelet rich plasma, which is called.
Do you want me to hold your hand? Do you want me to be here? Whatever you like.
I would love it if you were here. That'd be great. Yeah,
Whatever.
should be good.
I
I just
know
need
I
people.
wanna leave you with.
I need people distracting me.
Okay. I'll tap on your head.
Yeah. I figure if so many, I mean, and you've done it too.
Yes,
So I
yes.
figure that if so many people are doing it, it's obviously not a big deal.
I'm going to use, on the area that's numb, I'm going to use this tiny needle to give you just a drop more numbness.
Great. All the numbness I can take.
Right. And then this is the needle that goes, for the shot, which is also not so bad. It's smaller, way smaller than a blood needle for drawing blood.
I was gonna say it looks so much tinier.
It does. It is. All right, lie down. Now I'm going to put you in the stirrups. We don't always do that. Perfect. I'm going to keep having you move down. Almost, move down almost like you're going to come off the bed, like for a pap smear.
If I drop your head, it's a distraction.
Thank you. That's,
We do that for Botox.
I like that. That's a good
Or I
technique.
could, like,
Hey,
you know,
Move these down a bit.
tap you a little bit.
A shot.
No shot.
All right. This is a tiny numbing shot before the shot. Do you feel this?
No. Ooh, that I feel.
That's actually the numbing shot.
Oh, okay, cool.
So that was just the entrance for the numbing shot. You don't really feel any pain. You might feel a little bit of filling, much like the areas.
Is this for the clitoris
yeah.
or? Okay.
Do you feel that?
No. I don't feel anything.
You should feel a little bit of,
Sort of pressure?
pressure.
Yeah.
Right. Like maybe even like I have to pee a little bit.
I was gonna say, I
Not
was like, all of
you
a
know.
sudden I have to, a little bit have to go to the bathroom.
Right. Do you feel that at all?
I'm aware of it, but it doesn't hurt. Oh, now I feel like it's not a pain, but I'm aware that there's something
Right.
there's something
There's
happening
something
down there.
That was the shot for
That
the
was-
clitoris.
Okay.
Wow, really?
Yes.
That's
fun.
awesome.
Think fun
Yeah,
tonight.
I know. I'm like
Exciting.
cakewalk. This is a cakewalk.
He's like, I'm liking this.
Not so.
Not
Dramatic.
Not dramatic at all.
So enjoy.
Great. Thank you so much for everything.
To be continued. You can call me and tell me if there's any issues, or this is a surprise, or whatever.